Hello, my name is Dr. Dawn Gulick, and I am the inventor of the Mobil-Aider. I'd like to take this opportunity to explain a little bit of information to you regarding joint movements. Joint movements are classified as osteokinematic or arthokinematic. What we see on the outside of the body are the osteokinematic motions. That is the bending and straightening of the joint. These movements are typically measured with a device called a goniometer. A goniometer is nothing more than a glorified protractor that basically measures this angular motion. So it allows us to measure the degrees of mobility, of rotatory motion of the joint on the outside of our body. However, what's happening on the inside is very different. There are actually two components of movement on the inside that keep these two joint surfaces in contact with one another. There is both rolling and gliding. The rolling and gliding that occur inside the joint is known as the arthokinematics. This is a very important feature because if the rolling occurred in isolation, the joint surfaces would actually come out of contact. They would actually lose contact with one another, right, and risk stability of the joint. However, what actually does happen is rolling and gliding occur together. Again, rolling and gliding occur together. It's a very different motion than the rolling occurring by itself, okay, where you actually lose contact with the surfaces. All right? So rolling and gliding keep the two surfaces in contact. That's important for mobility and stability. So what happens with the Mobil-Aider device is that by putting it on the joint, we're able to actually assess that motion. There is the linear motion. And we're able to see a linear readout in millimeters of motion on the device. That linear motion is just that gliding motion. We're able to isolate that motion, and that's really important with respect to efficacious treatment. Being able to compartmentalize motion will tell us about what limitations might exist in a person's mobility and be able to address that specifically for better outcomes of treatment. Thank you.